Hey everyone, and welcome. And so today we are going to read about the endocrine system. This is step one, first aid, and this is on page 330. So, endocrine embryology, thyroid development. Thyroid diverticulum arises from floor of primitive pharynx and descends into the neck, connected to the tongue by thyroglossal duct, which normally disappears but may persist as cyst or the pyramidal lobe of thyroid. Foramen cecum is normal remnant of thyroglossal duct. Most common ectopic thyroid tissue site is the tongue, lingual thyroid. Removal may result in hypothyroidism if it is the only thyroid tissue present. Okay, so thyroid diverticulum arises from the primitive pharynx. It starts from the pharynx, goes down into the neck, and then connected to the tongue by the thyroglossal duct. So the thyroid diverticulum connected to the tongue by the thyroglossal duct. Now this thyroglossal duct disappears, but if it persists, then it can become a cyst or the pyramidal lobe of the thyroid. So, and if this thyroid glossal duct it goes away, then the remnant form of it is called the foramen cecum. Now the most common ectopic thyroid tissue is it can be in the tongue. This is called the lingual thyroid, and if this is the only thyroid tissue that is present and you remove this lingual thyroid, then the patient can end up with hypothyroidism. Now thyroid diverticulum starts at the pharynx, goes down to the neck, connected to the tongue by the thyroglossal duct, and thyroglossal duct should go away, but if it stays, it can become a cyst or pyramidal lobe of the thyroid, and if it goes away, the remnant is called the foramen cecum. And most common ectopic thyroid tissue is the tongue, and this is called the lingual thyroid, and if you remove it and it's the only thyroid tissue, then patients can have hypothyroidism. Thyroglossal duct cyst, this is when the thyroglossal duct that connects the thyroid diverticulum to the tongue, if it persists, then we say that it could become cyst or pyramidal lobe of thyroid. So thyroglossal duct cyst, if it's present, then how would it be present? If it persists, it would become a cyst, and this cyst would be presenting as an anterior midline neck mass that moves with swallowing or protrusion of the tongue. Makes sense, because the thyroglossal duct is the thing that connects the tongue to the thyroid diverticulum, and if it becomes a cyst, that means the thing that it connects to the tongue, if you move that tongue, the cyst would move. So it is the anterior midline neck mass, and your tongue, it's right in the front, so anterior midline neck mass that moves with swallowing and or the protrusion of the tongue. Now you compare it with persistent cervical sinus leading to pharyngeal cleft cyst. This is a cyst that is present on the lateral side of the neck. So comparing thyroglossal duct cyst to persistent cervical sinus leading up to pharyngeal cleft cyst, is thyroglossal duct cyst is anterior, compared to pharyngeal cleft cyst is lateral. Thyroid follicular cells, this is in picture B right here, and so thyroid follicular cells, it is derived from the endoderm, and parafollicular cells arise from the fourth pharyngeal pouch. So thyroid follicular cells from endoderm, and parafollicular cells, they arise from the fourth pharyngeal pouch. So this is the endocrine chapter, and this is the embryology part, and yeah, this is all for today. Thanks for listening, and bye.